Welcome to the American Society for Reproductive Medicine's micro video on non-medical pain interventions for endometriosis. One of the biggest predictors of the experience of endometriosis pain is the way a patient thinks about the pain itself. Catastrophic thinking involves overestimating the awfulness of an event, overestimating its likelihood, only considering the worst-case scenario, and underestimating one's ability to cope. Thinking catastrophically about pain involves thinking about pain as intolerable, not amenable to intervention, and inevitably life-altering. Catastrophic thinking about pain is associated with an amplified attentional focus on pain, increased disruption of cognitive activity, and a shift in focus to pain-related thoughts and sensations. Catastrophizing is also associated with a decreased ability to use effective coping strategies, and a decrease in the ability to experience analgesia from distraction. Catastrophic thinking about pain and its associated effects can be mitigated by reconceptualizing unpleasant or unwanted situations in more adaptive ways. Decatastrophizing endometriosis pain involves reconceptualizing pain as unwanted but manageable, and extremely uncomfortable but tolerable. Some useful techniques to aid in decatastrophizing are shown here. They include encouraging the patient to consider the best and most likely scenario in addition to the worst possible outcome, asking the patient what she would tell a friend who was having similar catastrophic thoughts, asking her to consider the costs and benefits of following a catastrophic thought, and developing a coping plan and coping self-statements to use when endometriosis pain arises. Sample decatastrophizing statements are shown here. It is often helpful to encourage the patient to generate her own coping statements, as these are likely to be more convincing to the patient than those developed by others. Reconceptualizing endometriosis pain increases the possibility of responding to pain with new behavioral responses. These include physical relaxation and mindfulness, activities that improve the patient's mood, focusing on activities that are engaging or distracting, and appropriate levels of physical activity or exercise. The ability to decatastrophize pain and engage in more adaptive behaviors in response to pain is associated with many improvements in outcomes for chronic pain patients. These include experiencing pain in a qualitatively different and less compromising way, decreases in long-term disability, changes in functional neural connectivity in the somatosensory areas of the brain, and improved quality of life. Thank you for your participation in this microcourse.